Hi there, Jamie here. So we're going to have a look at adjusting or mobilising or manipulating the pelvic joint, the sacro-iliac joint, with the painful side down. Now there might be times where you have patients where you can't actually lie them on a particular side. They might have too much pain, or they might have things like hip replacements. So you need to be able to really adapt and be able to perform your techniques in different positions. So we're going to have a look at the SI joint with the painful side down. Okay, so let's have a look at adjusting the sacroiliac joint with the joint down, so with the joint actually nearest the table. So for whatever reason, patients sometimes can't lie on certain sides, and you might need to work on the actual painful side that's actually in contact with the table as opposed to the painful side that's actually up. So we'd have our patient in the sideline position. Make sure the knees flex slightly, not too much twisting and rotation. So we're going to take our thenar eminence here, which is at the base of our thumb, and we're going to place that directly on the posterior superior iliac spine at the bottom. Okay, so it's going to go over the top like this, and it's going to fix on, and we're going to push down into the table and back towards me. Okay, so it's down and back towards me, so that's fixed. Now this hand, this is going to come over the top, so we're either going to use our forearm or we're going to use the palm of our hand, depending on what suits you. What we're looking to do is to squeeze that into us, squeeze it in, and it's going to create a little bit, just a very tiny rotary force in order to take the sacrum away from the ilium in that particular region there at that upper pole of the SI. Okay, so that's going to come over the top, that's going to come in there like that. We're going to squeeze, we're going to apply compression down, and just at the right moment we're going to drop down, and this arm's coming towards me and so is the lower one, so we're squeezing right at the last minute. That's our impulse. If you find that tricky with the forearm, what you can do is exactly the same. Come in, but this time you can use the palm of your hand. You might have to roll your patient a little bit more towards you, and we're going to come over the top onto the sacrum itself. Okay, get yourself in a nice athletic position. Roll the patient as one, not too much rotation, but just a whole roll, like a log roll, and then over the top, and then fix that lower one and drop, drop. The force is coming this way in order to take the sacrum away that way and actually open up this SI joint. So let's have a look, see what that looks like on the model. Okay, so if you have your patient on the table in the sideline position, just gently place one arm along their side. Okay, don't put too much rotation or too much rotatory force into it. Straighten out that bottom leg and just bend up that top leg. Okay, so we've got a little bit of tension all there already. They're starting to fall forward, which is absolutely fine. Let them hold on to their forearm. Slide my hand in. Remember, we're going to use our thenar eminence, so we're going to fix that on that PSIS, so that ilium at the bottom there. Okay, so it's going down and in towards me. Get myself side on, so I'm facing that way up the table. You can use our forearm. So that's fixed. Take a little bit of slack out the tissue, roll the patient as one. Okay, try not to do this scissoring type movement, because it will just often create pain and you'll feel your patient really tightening up. So use your forearm, roll the patient as one into you, so you get a good angle. Okay, reapply your levers, put some compression into it, and then as you feel that building, you're going to impulse this arm towards you, this arm towards you, both at the same time. And as I say, the sacrum is going to just scoop away, hopefully from that bottom sacroiliac, or from that bottom ilium anyway. Okay, so let's fix it down and in. Let's use our forearm. Let's roll the patient as one, get over the top of it, build it, and then impulse, impulse, impulse down. Okay. If you want to use your other hand, the palm, then all we need to do is place that one over the top of that one and just roll, and then we're going to do exactly the same, pushing through this one and pushing through this one. And that's a really nice technique. Take a bit of practice in order to open up, gap, adjust, manipulate that lower sacro-iliac joint. Okay. If you like the video, make sure you subscribe, make sure you press the like button and comment in the comments below.